Thank you, Mr. Ellison, and thank you, Ms. Clark. This is a very difficult hour to be with you. I cannot tell you how much it hurts me, how much it hurts the children of Wisconsin, of New York State, of Minnesota, and all the children throughout the country who don't know yet that their president has left them behind, that the president has turned away from children in need. What we're talking about is the difference between seeing a physician and gaining access to good health and not. And those children that don't get health care, don't get well, and when you're sick in school, you cannot learn, you cannot progress, you cannot move up into the middle class. This bill, the S-CHIP bill, and the veto by this president, a president who no longer represents traditional American values. He does not represent our values. This is a stark contrast between the two parties today. And it really asks the question, whose side are we on? I'm a Democrat. I'm proud to be a Democrat. We are on the side of people who are in need. It is the role of government, isn't it, to care for those who are in need. Not just Hubert Humphrey, but goes back 2,500, 5,000 years into all of our cultures, into all of our religious beliefs, into all that we hold spiritually sacred. We must care for those who are in need. The S-CHIP bill has been lied about by many politicians. Some have said it's going to cover illegals. That's a lie. There are no illegal human beings, no illegal citizens covered in S-CHIP. It does not cover rich people. 90% of people that would be covered by the S-CHIP bill have incomes below $41,000. Folks, the average cost of health care in this country is 12 to 14 grand per year. If you make $40,000, you can't afford health insurance today. You mentioned, Ms. Clark, $3.50 a day. And what are we spending in the religious civil war in Iraq? $400 million a day? $3.50 versus $400 million. The American people get it. And when I go back home to Wisconsin, I'm just as frustrated as our electorate. People believe their elected officials are not listening to them. We're listening, we understand your frustration, and we feel it in our heart as well. This is a veto that must be overturned. Now, when I was running for Congress, when I left my medical practice because 30% of the time I would write a prescription, but my patients either couldn't afford the medication, or it wasn't covered on the insurance company's list, or they simply couldn't get it. They didn't have the money. So I ran for Congress, and during my trails across the district, I had a 15-minute conversation set aside for a Native American activist. And that conversation lasted 2.5 hours. It took me 2 weeks to recover. But she taught me that it is politicians that determine who lives and who dies. It's politicians in this House that will determine who has access to health care and who does not. It's politicians that will take us to war based on lies and deceptions. We are the people's voice here. And if you would allow me to take a moment, I'd like to express the viewpoint of some of the people I represent. Chris Dion in Marinette wrote to me and said, quote, "I'm a single person, but cannot afford medical insurance unless it has a very high deductible. Then it is still expensive. I have many medical problems and cancer runs in my family. Afford tests or treatments because I don't meet requirements for free checkups," close quotes. Her story is one of millions. 47 million don't have any coverage at all. The S-CHIP bill makes fiscal sense. It's paid for. It doesn't raise taxes on anyone who isn't smoking. It is responsible, it's morally responsible to care for those who are in need. In my opinion, the President's veto of this bill is morally unacceptable, not just to me as a physician, but as a husband, as a father, as a congressman. It's unacceptable to every citizen everywhere in this country who has a human heart. I think we have to work hard with our colleagues in a bipartisan manner to care for those who are in need. We can do it with the S-CHIP bill that we created here in this House, the People's House. And I yield back.